Minister within the Ministry of Public Health, Honorable Dr. Karen Cummins, and a team from the Civil Defense Commission and the Regional Administration Region 3 visited the Lenora Diagnostic Center to assess the flooding situation after high tides early Friday morning.
Well, I'm very happy that I'm here almost on spot to see the damage that has been done by the flooding at the extreme high tide. I heard it's a phenomenon that occurs once in our lifetime. And so what I'm happy about that we were able to mobilize a team working public health, working with CDC. And so we were able to address the situation very quickly. As you see, we have managed to mop out, to clean up. We're having sandbanks, and so that we're able to prevent the water entering into the facility.
It was reported, and it was on a high tide alert in Region 3. The waters came approximately 20 feet above the seawalls, and subsequently the Lenora Diagnostic and Treatment Center was flooded. We were forced, because of this, to close the diagnostic center, and we have opened the Den Amstel Health Center, which is also named the Mildred Cox Young Health Center. We have opened it 24 hours. The same services that would have been offered at Lenora Diagnostic Center is offered here, except for x-rays and lab. All the persons who would need x-rays and laboratory services will be diverted to West Demerara Regional Hospital. So we would like to inform the public that Lenora Diagnostic Center will be closed for approximately the next 3 days, and all patients will be diverted to Mildred Cox Health Center.
The minister also assessed the Mildred Cox Young Health Center's capacity to function as a community hospital while the Lenora Diagnostic Center is shut down.
We have a large area. We can be waiting areas for patients and so on. We have like 4 rooms where we can accommodate doctors. We have a dressing room with a large capacity. We have a vaccine room also with a large capacity. There's a fridge also there to store drugs and so on. We can accommodate a good amount of patients.
We're going to have persons monitored until 6 hours. If they cannot be monitored, if there is need for them to be monitored beyond that 6 hours, they will be referred to West Demerara Regional Hospital.
At this point in time, we have closed the Lenora Diagnostic Center, and so we have shifted patients to the Den Amstel as well as the best or West Demerara Hospital. In the long term, we are hoping that we can work also with infrastructure to ensure that there is proper drainage around the center, as well as maybe put bowlers so that they could break the force of the wind. But in addition to that, we're trying to have smart hospitals, which will retrofit, more internal, make it environmental friendly, so that we won't have a situation like this affecting us so much.
The CDC continues to monitor the situation as a higher tide is expected.
In response to the situation in Region 3, particularly the impact of flooding in the communities of Sturteville, Lenora, and Iflot, the Civil Defense Commission is working in collaboration with the Ministry of Public Infrastructure, the Ministry of Public Health, the Guyana Fire Service, the Region Administration, to bring some amount of immediate relief to the affected communities, particularly the residents. So based on the expected high tide in another 3 hours or so, the immediate action that is taken is to try and help secure the hospital and secure the homes of the residents, preventing water from going in the upcoming high tide. So what we have done, we've acquired a number of sandbags, and those sandbags were used to secure the hospital, and we also distributed those sandbags to the various communities, to the residents, so that they can secure their homes.
Reporting from Lenora on the west coast of Demerara, Region 3, I am Delicia Haynes.